Hi, and thank you. Thank you for that introduction, and welcome everyone to the importance of taking care of your whole self, mind, body, and soul while in recovery. I struggled with how I was going to present this to everybody. So bear with me. We're in this together. I have my cheat sheets and I'm ready to go. I have handouts that I am willing to send to you once I share my information at the end. Feel free to take that down, reach out, and then I will send it to you. I didn't want to have to fuss with it during the presentation. So excuse me, also for those of you that are familiar with Zoom, there's an opportunity for me to show a video panel where I can see myself as well as you all. So I wanted to be clear of that because when I pull it up, I'm going to drag it as low as I possibly can, but on your end, you may possibly see a little black box. I have checked over this and it should not be covering any of my presentation. I just want you to know that it will be there. So anyways, without further ado, we will go ahead and get started. So I will share my screen. Again, I've got my cheat sheets, so I'll be using those and yeah, discussing substance abuse, mental health, and self-care, all while being in recovery myself. I am 17 years sober. October 15th, 2003 is my birthday. And yeah, I'm really excited to be here and talk about these statistics and what we can do differently and how we can band together and make a difference. And in that, I will be sharing my story kind of in between, but at the end, feel free to ask questions. Yeah, so we will go ahead and get started. So let me get that screen shared. I'm going to get the screen shared and then I'll go put the video up. So hold on. All right. All right, got that. So give me 1 second. Now, okay, I got my little video up. I don't know if you guys can see it. It's right here. So I'm just gonna hide it. Okay, great. And then go ahead and get this started. Maybe. We want to play from the beginning. Let's get this to the beginning. Whoops. Sorry, guys, technical difficulties. Of course. Oh my gosh. Okay, let's try this again. Perfect. Okay, so let's go ahead and get this presentation started. Again, welcome. So glad to be here. Glad you decided to join me on this journey today. As I said before, I wasn't exactly sure how I was going to complete this presentation for you all to be most effective. I went back and forth with a few ideas and finally just decided on speaking my candid truth. And that is on what I know best. And that is being a woman, being a Black woman, being a Black woman that manages mental health, as well as being a Black woman that manages mental health in long-term recovery, practicing to strive for a better self each day, mentally, physically, and emotionally. You can see on this slide here, I thought this was really powerful. I really enjoyed this, so I thought, why not? And I love Maya Angelou, so I figured I'd put a little something up also. So it's the fire in my eyes, and it's the flash in my teeth, the swing in my wrist, and the joy in my feet. I'm a woman phenomenally. Phenomenal woman. That's me. Okay. In today's presentation, I will discuss the history of mental health in African American communities, strategies for engagement, conversation regarding local and nationwide resources, to help in advocating for change, share ideas and practices for self-care, all while sharing some of my own personal experiences. There will be time at the end for questions. I will share my resources and other information as I had stated before. Though I don't have the handouts today physically, I will send them to you if you so choose. So let's go ahead and get started. Ethnicity and Health in America series, Substance Abuse and Addiction in the African American Communities. Drug addiction is a chronic disease defined by compulsive drug-seeking behaviors that has the potential for reoccurrence, relapse, and recovery. While addiction is a medical disease, it remains a stigmatized disease, which affects substance dependence research, prevention, treatment services, and legal policy in the United States. In 2015, almost a quarter of adolescents and adults in the United States, 66 million Americans, reported binge drinking within the past month. In that same year, 27 million Americans reported dependence or misuse of illicit or prescription drugs, despite relatively uniform rates of substance abuse among racial and ethnic populations. There is a disproportionate rate of drug arrests for African Americans. In addition, members of racial and ethnic minority groups are most likely to experience barriers that impede their ability to assess substance abuse treatment. We must examine how to make accessible, retain, engage, and support African American individuals who are seeking to end their substance dependency. During the month of February, we commemorate African American Heritage Month. This month, the Ethnicity and Health in America series will be raising public awareness about substance abuse and addiction among African Americans. A lot of my slides are full of statistics. I'm going to go relatively quick, so of course you're not going to be able to read it all. Again, I have no intentions not to share this later, so just let me know. I just think that addiction and mental health is, it's very near and dear to me, clearly, and I think that is important to see it just as much as hear it. So yeah, I wanted to put in as much information as I could without it being too overwhelming. So anywho, all right. So the African American community has a statistically higher percentage of substance abuse than the general population. The following are some of the reasons for the high rate of addiction in African Americans. The inferiority complex resulting from the poverty of the urban areas that many African Americans inhabit, the high concentration of drug and alcohol sales in African American residential areas, the apathy towards education that keeps many African Americans trapped in illiteracy and poverty, the lingering Jim Crow prejudice that prevent African Americans from obtaining jobs that pay them as well as white Americans, the drug use of African American role models who seem unafraid of white rules or oppression and use violence to maintain a fearful respect of others, and the cultural expectation of white Americans that African Americans will drink heavily, abuse drugs, drain resources, and hamper society. Lastly, the despair of being a part of an oppressed and marginalized social group whose human rights seem to have reached a standstill. As long as the African American community is left in this rut, the issue of drug dependence among them will never improve. So let's talk about the differences between whites and African American drug addicts. Addiction specialists cannot afford to use a generalized approach for all of the patients or clients, however you call them, as African Americans face many challenges foreign to white addicts. Members of the white community usually begin their addictions because of the following reasons, among others: the stress resulting from pressure to excel, the desire to escape a painful life, or the fun with their friends that claim that drugs, the fun their friends claim that drugs bring. While in African American communities often have different relations with the drug world, including the following situations: living dominant by drug lords who control their families with debt, needing to sell drugs to supplement their family's inadequate income, emulating their African American role models who are feared fighters and abuse drugs regularly, seeing drugs regularly abused and easily obtained in their communities. Those working with African Americans in addiction recovery, like myself, must know about the African American experience in order to administer effective healing therapy. There are ways to approach addiction in African Americans. There are therapists specializing in African American recovery treatment that may utilize the following strategies: presenting recovery as a way to redeem the ancestral slavery by breaking out of the addiction, asking the patient or client what particular strength they pose and explaining how sobriety can help regain these, and referencing recovered African American addicts, ensuring them that with help, any African American drug addict can recover. So with that being said, we will then move on to mental health. So touched on a little bit about the addiction and now mental health. So I'll read this slide and then we'll move forward. Mental illness isn't a uniquely modern phenomenon. The genetic influences that stand behind some types of mental illnesses, along with the physical and chemical assaults that that can spark illnesses in some people, have always been a part of life. But the ways in which impacted people are treated by their peers, as well as the help ill people might get from their doctors, has undergone a significant amount of revision. In fact, the ways in which modern cultures both understand and deal with mental illnesses have undergone a radical transformation. However, much work remains to be done if people who have mental health concerns are to reach their true potential. And to say this as exponentially tough times for Black people in America would be an understatement. And that's why protecting the mental health of this community is vital. The deaths of Breonna Taylor, George Floyd, and now Jacob Blake, among countless lives lost at the hands of police brutality, in addition to simultaneously experiencing a disproportionate rate of deaths from COVID-19, have left many people of color fighting through psychological warfare. During this mental health state of emergency, Black communities are not only protesting, but many are also looking for ways to find peace. In recent times, attitudes towards mental health issues appear to be changing. Negative attitudes and stigma associated with mental health have reduced, and there has been growing acceptance towards mental health issues and support for people with them. Despite this shift in attitude, the idea of mental health awareness campaign is not a recent one. In the late 1940s, the first National Mental Health Awareness Week was launched in the United States. During the 1960s, this annual weekly campaign was upgraded to a monthly one, with May being the designated month. During this month, National Health America, the main organization which sponsors this event, run a number of activities which are often based on a theme. And in 2010, the theme was Live Your Life Well. Live your life well. Encourage people to take responsibility for the prevention of mental health issues during the times of personal challenges and stress. Many mental health problems can be avoided by taking positive lifestyle changes and choices and how we act and think before they can manifest. To coincide with Mental Health Awareness Month, other mental health campaigns and activities also run during this month. National Children's Mental Health Awareness Day is one such campaign. This event is sponsored by the American Psychological Association, better known as APA. Other activities have included blogging for mental health and help for people seeking psychological services. As you can see the slide that I have up, Minority Mental Health Month. Mental illness doesn't discriminate by your background or race, but access to care might. You are not alone. NAMI, You Are Not Alone campaign features the lived experiences of people affected by mental health to fight stigma, inspire others, and educate the broader public. Now more than ever, the mental health community must come together and show that no one is ever really alone. The campaign builds connection and increases awareness with the digital tools that make connection possible during a climate of physical distancing. NAMI supports all diverse backgrounds, cultures, and perspectives, reminding everyone that you are not alone. July is Minority Mental Health Awareness Month. Help us spread the word through the awareness, support, and advocacy activities. Share minority mental health awareness information, images, and graphics, hashtag minority mental health, all throughout July and any other month, honestly. America's entire mental health system needs improvement, including when it comes to serving the marginalized communities. Mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental illness regardless of their background. However, background and identity can make access to the mental health treatment much more difficult. National Minority Mental Health Awareness Month was established in 2008 to start changing this. Each year, millions of Americans face the reality of living with a mental health condition. Taking on challenges of mental health conditions, healthcare coverage, and the stigma of mental illness requires all of us. In many communities, these problems are increased by less access to care, cultural stigma, and lower quality of care. African Americans are 10% more likely to experience serious psychological distress than any other race. Experts agree that these alarming statistics will only increase without elevated access to coping mechanisms. Mental health advocates, like myself, have become guiding lights, leading to the charge and uplifting the spirits of people of color, and have provided best practices for surviving through these triggering times. I am so tongue-tied. I'm so thankful that I have this cheat sheet. I joke and make light, but clearly I have mental health. I manage my own mental health and have for years. I struggled prior to that, and now in a field where I can advocate and assist and support the best way that I can. So I'm very thankful to be here and very thankful to do that. So making light sometimes is part of it. So anywho, moving on. America's entire mental health system needs improvement, including when it comes to serving marginalized communities. When trying to access treatment, these communities have to contend with, language barriers, a culturally insensitive system, racism, bias, and discrimination in treatment settings, lower quality of care, lower chance of healthcare coverage, stigma from several angles for being a minority and for having a mental illness. These are all in addition to the usual roadblocks. Many cultures also view mental health treatment as a luxury, considering symptoms as a phase that will eventually just pass. These harmful perceptions of mental illness can further isolate individuals who desperately need help. I see this all the time in my clients and with what I do. It's their grandmother or their great-great-grandmother or great-great-great-grandmother just wasn't talked about. It's not something that they did. It's, she just drinks a lot, or, she just mumbles. She's talking to herself. Well, it's a little bit more extensive. And because it is so hush-hush and there is a stigma, it's not getting treated properly. And so by the grace of our higher power, whoever that may be for you, if you believe or not, regardless, life is improving on that end. And so we can only go up. Very thankful for that. Excuse me. All right. Here's the next slide. So stigmas all too often keep people from seeking the mental health care they need and deserve. But even worse, some people feel those stigmas more strongly than others. African Americans receive mental health care at half the rate that Caucasians do, according to a 2010 study, even though both experience the same rates of mental illness. Many African Americans are skeptical of mental health professionals, and their skepticism is understandable. Therapy has not always been accessible to African American communities, nor has it always offered quality care. Even more mental health care professionals at times have set themselves against community support networks that many African American clients rely on. A difficult history cannot be denied, but the future looks much different. More recent studies show that African Americans are seeking out and receiving the therapy that they deserve. Mental health care is becoming more accessible, and therapists are offering quality mental health care. I will say, and I tell my clients all the time, that Austin is the best place for resources, period. You got to work at it. And you got to stand in line, and you got to make phone calls, and you've got to, do. But it's available for you as long as you take advantage of it and utilize it properly. It's helpful and it's there. Starting conversation about mental health in your community may feel very intimidating, especially if your community views mental illness as a personal fault or weakness. But the more we talk about mental illness, the more normalized it will become. Make sure to stress the importance of a culturally competent provider. These mental health professionals integrate your beliefs and values into treatment. To find a provider that does this, you may have to do a significant amount of research. In addition to searching online, you can also ask a trusted friend, family member for recommendations, ask for referrals from a cultural organization like a fraternity or the NAACP, and they can be helpful for the community. I've got some resources I'll show here also in a little bit. When a person experiences mental health symptoms, one of the most helpful and important and comforting feelings is knowing that you are not alone. It can be incredibly reassuring to know in this moment right now, someone else is going through similar struggles as you are, regardless of where they are, who they are, or how they identify. So you can see that I have kind of gone through a few slides. I'll kind of go back a minute. Sorry about that. So let's see. Okay. So as I said earlier, I just want to be able to have this in your face so you can see it and you can actually wrap your head around it a little bit. Seeing is believing. And again, these numbers are from 2019. And though some of them are better, there are still some that are stagnant or worse for that matter, depending on the area that we African Americans, brown people are in. This one, I think, really kind of stuck with me. I did want to touch base on some of these. So let me say this, the information on these infographic slides, and that would be the slides that I have up, which are, I think, are slides 12 through 15. And this page comes from studies conducted by organizations like Substance Abuse and Mental Health Services Administration, which a lot of us know as SAMHSA, or the Center for Disease Control and Prevention, the CDC, and the U.S. Department of Justice. The terminology used reflects what is used in the original studies. Terms like serious mental illness, or mental health disorders may all seem like they're referring to the same thing, but in fact refer to specific diagnostic groups for that particular study. So I kind of want to put that out there also, and that's why I wanted to touch on some of this ripple effect of mental health. It's so important to get your mental health under control and managed, because it's not only affecting you, but it's affecting those around you. And you could even, for those that may be pregnant that are struggling with mental health, could be also what's the word I'm looking for? The energy and your stress, your baby feels that. So there's that too. The ripple effect of mental health. So I want to say a couple of things. So for yourself, which one stuck out? I wanted to read, people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population. People with serious mental illnesses are nearly twice as likely to develop these conditions. Family. Caregivers of adults with mental or emotional health issues spend an average of 32 hours a week providing unpaid care. That is insanity. Oh my God, that's just so much. But if we could just get the people that we need to get to the resources and allow them to get them at a legitimate cost and not outrageous, that it's going to be effective and meaningful, we could alleviate so much. Community. Mood disorders are the most common cause of hospitalization for all people in the U.S. under age 45, and that's after excluding hospitalization related to pregnancy and birth. That is incredible. I mean, people, I could talk to people, I could talk to you guys for days about this. It just breaks my heart that instead of allowing someone the proper resources, and I don't mean hospitalization, I mean therapy, medication management, if that's what they choose, holistic management, whatever the case may be. It's just, this doesn't have to be, guys. We're here to make a difference, and we're here to do something about that. And that's why I'm here today. And then a little piece on the world. So depression is a leading cause of disability worldwide. And because of the African American community and how it's a stigma and how we push things under the rug, it doesn't get managed and taken care of. It doesn't get addressed and taken care of and managed. So yes, our sisters and brothers will end up being institutionalized, hospitalized due to that. We can change that. We can change that. Here, so the next few slides, as I said before, just like random resources. This one specifically talks about stressors on diverse ethnic racial groups, racism, discrimination, violence, poverty. Mental health disparities factors. Members of the ethnic and racial Minority groups in the United States face a social and economic environment of inequality that includes a greater exposure to racism, discrimination, violence, and poverty, all of which that take a toll on mental health. So it's just like this crazy cycle. So how and when are we going to break it, right? We're going to band together. That's what we're going to do, band together. The health crisis. So in 2018, for the first time in history of such research, the rate of suicide for Black children between the ages of 5 and 12 has exceeded that of white children, and more than a third of elementary school age suicide involved Black children. That is disgusting and should not be. It is up to us to teach and lead the next generation, and to do better and to be better. And I mean, a 5-year-old committing suicide is unfathomable. You know what I mean? It's hard for me to believe. It breaks my heart. And that's kind of what, again, I wanted to put it on here. Seeing is believing. When I saw that, it just like hit me. And so I wanted to make an impact with that. So the next piece is the representation matters. Only 6.2% of psychologists, 5.6% of advanced practice psychiatric nurses, 12.6% of social workers like myself, and 21.3% of psychiatrists are members of minority groups. I work for a company, and I am one of 3 Black people. 3. All female. I am in the outpatient program. My sister, coworker, is in the inpatient program. And my other sister, coworker, she works overnight. So none of us ever see one another. So technically, we feel as if we stand alone, and that's not how it should be. And so I am very active in our diversity, inclusion, and equity, diversion, equity, and inclusion committee, which we just recently changed the name to the Equity Task Force, because equity includes all of that, equality and diversity, and we're at task. We're trying to go to task and be forceful and make a difference and change our community and change our place of business and open our arms physically and virtually so that people know that we're there, and we're with them. And so then that takes me to the community stigma. In research studies, Black people have indicated that mild depression or anxiety would be viewed as crazy in their social circles. Many of those interviewed also believe that discussions about mental illness would not be appropriate even among family. I deal with it all the time. And I'm sure you all have probably dealt with it in your place of business, professionally, of course. So that concludes that portion as far as the mental health goes. These next several slides, very overwhelming, but they are resources specific to Black people in our community, locally, nationally, internationally. One that has, I figured I'd read 1 or 2 off of each page. So for instance, the Black Mental Health Alliance provides information and resources and a Find a Therapist locator to connect with a culturally competent mental health professional. And that's one of any color. However, 99% of them are Black. And I know that only because I've been a part of that organization for some time. Let's see, the Black Women's Health Imperative organization advancing health equity and social justice for Black women through policy, advocacy, education, research, and leadership development. Here's another that stuck with me, Brother, You're on My Mind, an initiative launched by Omega Psi Phi fraternity. And basically, it's raising awareness and allowing other Black brothers associated with depression and stress, et cetera, and their families to come to get resources from them to spread the word, and to be able to support one another. Melanin and Mental Health connects individuals with culturally competent clinicians committed to serving mental health needs of Black and Latino Hispanic communities, promotes growth and healing of diverse communities through its website, online directories, and events. This one here, I liked all of them, but one specifically was the POC, Person of Color, online classroom. So it contains readings of importance of self-care, mental health care, and healing for people of color and within activist movements. So it's literally just multiple classrooms and classes and courses and resources. It's something that when we're going to go into self-care, this next piece, it's something that you could, part of self-care is reading, right? So it could be something that you choose to do while working on your self-care. At the same time, you can retain information that you can later utilize in that cycle that you're breaking, right? So Black mental health resources, Black Therapist Rocks. Love that website. I just came upon it in the last few months, and I think it's incredible. It's literally like a Black person directory, therapist directory. It's great. Really like it. You can put in what you're looking for and it will narrow it down for you. For those that aren't familiar with psychology today, it kind of reminds me of that a little bit. And you can also put yourself on it as well if you're a therapist. And then ThriveWorks, they have specific groups targeted for African Americans due to the increased population here in Austin. I think that's a great resource. And the Hogg Foundation for Mental Health. I do some research studies. I work as a research associate with the University of Texas Del Med, and I'm familiar with the Hogg Foundation and really enjoy working with that group of people. It's an incredible foundation organization. So something to look into also, especially for those that are local. Okay, and then treatment directories. So specifically, I wanted to touch on the LGBTQ plus community, the Psychotherapists of Color Directory, and then the National Queer and Trans Therapists of Color Network. The people that I work with are addicted to substances and also manage HIV and AIDS. And so that community is near and dear to my heart, and I just found out about the National Queer and Trans Therapists of Color Network and loved that site, loved it. So so there are those resources to touch on the mental health that we just spoke on, and then the addiction that we spoke on prior. Now, we move on to self-care. So food for thought. Prior to the coronavirus pandemic, Black maternal mortality rates had already risen to 4 to 5 times higher than that of white women, according to the CDC. Now, in addition to the disproportionately rising death tolls of Black people due to coronavirus, studies show this could impact the rate even further. There are also several that fear for the future lives of Black children and how they will be viewed in the world. But let's talk about joy. Talk about what's possible for us. Talk about our greatness and our excellence. But also, let's talk about just what it means to reclaim joy and exist as a Black person in this time today. That is our birthright. Black people have generationally had to overlook their own emotions, pain, well-being, mental health, and trauma to take care of white people's feelings. We have had to perform this numb, strong role for so long that we forgot, or perhaps didn't even realize it was necessary to take care of ourselves first and foremost. Experts advise that now is really the time to pour back into ourselves if you haven't done so in the past or already. It's time to make that time for yourself. It is paramount. Self-care, although fun, isn't just face masks, soaking in the bathtub, and completing these scenic yoga poses, right? It isn't something that you do occasionally. Self-care is a choice to do things that speak to your heart and soul in ways that nourish you, pick you up, and keep you going to face life again tomorrow. It is that thing that you do that makes you feel alive, sustains you, and fills you with gratitude. For so long, women of color have been told what self-care looks like from perspectives that are not like that of their own. While there is nothing wrong with the woman of all walks of life spreading all kinds of self-care, for the women of color, it looks a little bit different than their counterparts, particularly because self-care for us is tied into so much culturally, racially, politically, spiritually, and medically. It will not typically look like green smoothies and Lululemon on the beautiful beaches of the South Pacific. In African American communities, we are used to seeing the brown and Black women taking care of everyone else's needs before their own. There's a fear that if we don't do so, then we are labeled as selfish or uncaring by our very own people. I have seen women labeled as selfish because they prioritize the gym and their own therapy over a request of a family member that has asked of them. However, women of color can be so selfless. In fact, due to this, we end up taking care of ourselves, we end up not taking care of ourselves and put others at risk and put ourselves at risk for major health and wellness concerns. Women of color have the highest risk of obesity, depression, anxiety, and heart disease because we do not take better care of ourselves and don't manage our stress appropriately. Depression and anxiety is what I suffer from. I am diagnosed with obsessive compulsive disorder. It's one thing I hear people say all the time, oh God, I'm so OCD, I do this, I do that. It has affected my life drastically. And without therapy and medication management, I don't know where I would be today. It has caused me to lose jobs, to lose relationships, to lose a sense of self. And then depression just falls alongside with that. And it has taken a lot of effort and time, but I could not be happier with where I am today, and can't express that enough. But to go on, enough is enough, right? It is okay to help others, but not at the cost of helping ourselves, of not being able to help ourselves. Self-care for the women of color is a lifestyle, a daily practice. It is a reset, a recharge, a readjust, a restart, a refocus, reclaim, reemerge, release, all of it, as much as you want, whenever the heck you want. It is putting your whole mind, body, and soul into it. Self-care for the woman of color is a radical act that goes against everything we have ever been taught to be. Here are some of my favorite self-care practices. Finding stillness. It is important to listen to your body and take time to process everything being experienced, especially in this hustle and bustle of this crazy world that we live in. And now COVID is involved. It's a lot. So allowing yourself time to be still, fully process is how we access our calm mind as well as access our higher solutions. A calm mind is a powerful mind and tool. This is vital in times of challenging chaos, planning, organizing, and uprising. Spend some part of the day centering into your power. Meditations and breathing practices are great for this. There are a wide variety of virtual meditations available for free or at low cost. I am huge into YouTube. There are so many things that you can find, and I love it, love it, love it. Quick 5-10 minute meditations you can do before you get up, after you go, or before you get up, or before you go to bed, or in the middle of the day, or whatever, but it's super helpful. And the Calm app, love it. Love that. It costs money, but utilize it for the trial and then be done. I shouldn't be saying that. Another thing I like to do is group therapy. So it's join a safe space or group therapy. This is a great way for people who haven't necessarily gotten their feet wet in therapy and want to access a free source with those alike. Very helpful. Recently lost my mom. It's still recently. It's still in the first year. The anniversary of her passing is March 4th, and that is right when COVID hit last year. And so what I did was join a grief support group, and it has been excellent and super helpful. Not just for the grief purpose, but I've now made long-lasting relationships for the rest of my life out of that. So it's been great. Move mindfully. One or more ways for a mental relief is to circulate the energy in your body around you. So it's kind of like finding your stillness, meditation, stretching, whatever that looks like for you. Practice self-compassion. The things we say to ourselves are not typically what we do, right? So practice loving kindness by turning understanding, love, and acceptance inward with the mirror, right? Forgive yourself for what you do and what you do not know, and recognize that you are imperfectly perfect. You will continue to make mistakes. Just accept it and move on. Learn from it. Another one I like is reaching out. I am huge at reaching out because of my mental health. I think that it's important for me to, when I'm feeling a certain kind of way, I want to make sure that it is in the universe and people know what's going on around me. So I will shoot a simple text to somebody that I know and trust and supports me and is there for me to listen, not to talk, but to listen. And that helps me. Emotional pain is killing us slowly, and stop suffering in silence. Reach out. Why not? There are plenty of people out there to help. Utilize it. Take advantage. Love it. Embrace it. As I said earlier, it's like, as a therapist, I know the importance of therapy and its benefits. So I have never been afraid of it. That's the first thing I do when I move into a new town is I find a therapist immediately. I do not have to have insurance because I know that I am willing to go at any lengths to get what it is that I need to make sure that I stay sober and that I stay healthy mentally, physically, and emotionally. I'm not perfect, and I have bad days, and I have good days, and I have great days. But without my therapist and medication management, I'm not sure where I would be today. Another one is inhabit your body. So inhabiting the body means that we live within our body, that we are present throughout the whole internal space of our body. It means that we feel that we are made of a consciousness everywhere in our body. So mindful, being mindful, right? I think about the senses. So, stop and smell the roses. What does it look like? What is it? What are you hearing from the rose? Or, like in the wind or something? How does it feel? How does it taste? What is it? My five senses, I already lost it. Sight, hearing, touch. Oh my gosh. Utilizing that taste, feel, and that will literally take you into a different place because your mind is off of whatever it is that you went into it with, right? So that's really helpful. Set boundaries and say no. This is very, very, very difficult for people to do. For sure. Because sometimes it's a friend, sometimes it's a family member, sometimes it's your partner. But we give them power to be toxic and take over our day and our life and drain us and take our energy. So it's for us, we need to learn to cut the cord. You can let the people know that the impact that they have on you, you just can't right now. And you need to love them, but it needs to be from afar. Take the time that you need. It's not forever, but it's for right now. Let's see. And I've had this slide up for some time. There's also this other one as well, but I wanted to be able to touch on mind. So focusing on your self-care, mind, find a great therapist, art, doodle, finger paint, dance. I have a girlfriend that takes random dance classes on Zoom and just dances around the office as an outlet. It's a beautiful thing. I love it. Belly. So drink lots of water, cook your favorite meals, take yourself out to eat. Body, breathing, right? Daily stretches. Love a good bath with some Epsom salt, lavender. Love it. Massage. If you have the opportunity, the financial stability to do that, I highly recommend it. There's some great places in this area. I splurge every once in a while because of the job that I do. I think it's helpful. I carry a lot of stress on my shoulders, which most people do. So anyways, and then spirit. So creating healthy boundaries. I put that one first so everybody would see that. And then love the outlet of screaming. I have a group where I have a couple of groups. I have one that's a silence group. I have one that is a screaming group. And then I've got another one that is a laughing group. And the screaming group, it's hard for people to get involved at first, but once one person gets involved and they understand the reason why we're doing it, it is such a powerful and energetic and therapeutic piece. And it's a crazy way to start the day, but a perfect way to start the day. So, so those are the slides. And in conclusion, we must be better physically, mentally, and emotionally for ourselves first, both when things are bad and when things are good. By practicing these things when they are good and bad, we make self-care a part of our every fiber. And when we can be better for ourselves, we can be better for others. That's all I got. I'm done. Just like that, I've concluded my presentation. Questions?